A few years ago, my brother Michael called me. It was 7 in the morning, and I could tell something was wrong just by the sound of his voice. He told me he'd woken up like any other day, got out of bed, walked to the kitchen to start the coffee, and halfway there the room started spinning. He grabbed the counter so he wouldn't fall. Michael was 64. He walked every day. He didn't smoke. His blood pressure was, in his words, a little high, but nothing serious. If you'd asked me the week before, I would have said my brother was one of the healthy ones. That morning changed how I talk to my patients, because what happened to Michael wasn't random, it had a cause. And that cause is something almost every person watching this video is doing right now, every single morning, without knowing it. I'm Dr. Frank Thomas. I've been a cardiologist for over 20 years, and in the next 15 minutes, I'm going to explain exactly what happens inside your body in the first few minutes after you wake up. Why that window is riskier than people realize, especially after 60. And I'm going to give you 3 simple habits, the same ones I gave my own brother, that can lower that risk starting tomorrow morning. Let's get into it. To understand what happened to my brother, you need to understand something most people never get told. Your heart doesn't wake up at the same speed you do. While you're sleeping, your body is quiet. Your blood pressure drops. Your heart rate slows down. It's the calmest your heart will be all day. Doctors actually have a name for this. We call it nighttime dipping. It's normal and it's healthy. But the moment you open your eyes, everything changes. Your brain sends out a signal and your body releases hormones, things like adrenaline and cortisol, to wake everything up. Your blood pressure rises, your heart rate climbs, your blood vessels tighten. This happens to every single person, every single morning. It's not a disease, it's not a warning sign by itself, it's just how the human body is built. Here's a simple way to picture it. Think about a car that's been sitting in the cold all night. The engine is off. Everything inside is still. Now imagine starting that car and immediately flooring the gas pedal before the engine's even had a chance to warm up. That's what happens when you snap out of bed and get moving right away. Your heart is being asked to perform before it's had a moment to catch up. Now here's the part that matters most. Researchers have studied this for years, and they've found something important. Heart attacks and strokes happen more often in the morning hours than at any other time of day. Not because mornings are dangerous, but because that's when your heart is under the most sudden strain, especially if you're pushing it too fast, too early. For most people in their 30s and 40s, the body handles this surge without a problem. But after 60, your blood vessels are naturally a little stiffer. Your body doesn't adjust as quickly as it used to. That surge that used to be a small hill becomes a steeper climb. That's exactly what was happening to my brother Michael that morning. His body was in the middle of its natural morning surge, and he stood up and started moving before it had leveled off. His blood pressure couldn't keep up with what he was asking his body to do. I want to be clear about something. This is not about being afraid of your own mornings. This is about understanding a pattern your body follows every single day, so you can work with it instead of against it. In a few minutes, I'm going to show you exactly what that looks like. But first, let's talk about the specific habit that turns a normal morning surge into a real risk. So let's talk about the habit. The one I promised you at the start of this video. And I think you're going to recognize it immediately, because I guarantee you've done it this morning. It's this: getting up too fast and moving too fast in those first few minutes after waking. That's it. That's the habit. I know that might sound too simple. You were expecting something more complicated, maybe something about food or coffee or exercise. But the truth is, it's this basic. And because it's so basic, almost nobody thinks twice about it. Let me break down exactly what's happening, piece by piece. First, overnight dehydration. You go 7, 8, sometimes 9 hours without a single sip of water. Your blood becomes just slightly thicker by morning, not dangerous on its own, but it's one more thing your heart has to work against. Second, standing up too quickly. When you go from lying down to sitting to standing in just a few seconds, gravity pulls blood down into your legs faster than your body can adjust. For a lot of people over 60, this causes a brief drop in blood pressure to the brain. Doctors call this orthostatic hypotension. You might know it by how it feels, that quick head rush or moment of dizziness when you stand up too fast. Third, jumping straight into activity. Answering the phone, rushing to let the dog out, carrying laundry down the stairs, reaching up into a high cabinet. All completely normal things, but all happening at the exact moment your blood pressure is already surging from waking up and your body hasn't leveled off yet. Individually, none of these are alarming, but put them together, dehydration, standing too fast, and jumping into activity, and you've stacked 3 things on top of your body's natural morning surge, all within the first 5 minutes of your day. That's what happened to my brother. He hadn't had water since dinner the night before. He got out of bed quickly because he wanted to start the coffee before his wife woke up, and he was already moving toward the kitchen on his feet when the dizziness hit. I want to say this clearly because I don't want anyone watching this to be afraid to get out of bed tomorrow morning. This is not about panic. This is about timing. Your heart isn't weak. Your body isn't failing you. It just needs a few minutes to catch up before you ask it to perform. That's all this is. And the good news, the really good news, is that this is one of the easiest things in the world to fix. In a few minutes, I'm going to walk you through exactly how, step by step, the same steps I gave to Michael. But first, I want to talk about who needs to pay the closest attention to this. Michael's story is what changed how I talk to my patients. But I want to share another one with you, this one based on patterns I've seen again and again in my own practice. I've changed some details to protect privacy, but the situation is very real and very common. Let's call her Dorothy. She was 71, lived alone since her husband had passed a few years earlier. Every morning her routine was the same. Alarm goes off at 6:30. She'd sit up right away, swing her legs over the bed, and stand up in almost one motion because she liked to get moving before the day got busy. One morning her daughter called to check in, like she did most days. Dorothy didn't answer. Called again an hour later. Still nothing. She drove over and found her mother on the bathroom floor, conscious but shaken and unable to get up on her own. Dorothy was lucky. It wasn't a heart attack. It wasn't a stroke. It was a fall caused by that same quick drop in blood pressure we talked about earlier, the one that happens when you stand up too fast, especially combined with mild dehydration overnight. But here's what stayed with me. Dorothy told me afterward, "I've done that exact same routine every morning for 15 years. Why did it happen now?" And that's the honest answer I gave her. It's not that she did something differently, it's that her body, at 71, no longer adjusted to that fast morning routine the way it did at 55. Nothing had gone wrong with her heart, nothing had gone wrong with her health. Her body had simply changed with age, the way all of ours do, and her morning habit hadn't changed along with it. That's the pattern I want you to remember. It's rarely one dramatic thing. It's a routine that used to be fine, meeting a body that has quietly changed over the years. The good news is, once Dorothy made a few small adjustments to her mornings, the same ones I'll walk you through soon, she never had another fall. She still lives independently today, and she still gets her coffee every morning. She just gives her body a few extra minutes to catch up first. Now, I want to be very clear about something. What I've described so far happens to everyone. Every person's blood pressure rises in the morning. Every person's blood vessels have to adjust when they stand up. This isn't rare, and it isn't a disease. but some people carry a higher risk than others, and I want to walk through exactly who that is, so you know if this section applies especially to you or to someone you love. If you're over 60. As we talked about, your blood vessels naturally get a little stiffer with age. They don't stretch and adjust as quickly as they did in your 30s or 40s. That means the morning surge and the drop when you stand up both hit a little harder. If you have high blood pressure, this might seem backwards, but it's true. If your blood pressure already runs high, your morning surge is often larger too, and many blood pressure medications affect how your body adjusts when you stand up, which can make that quick head rush feeling more likely, not less. If you have diabetes. Diabetes can affect the nerves that help control blood pressure adjustments. That means the automatic system your body normally relies on to catch a sudden drop doesn't respond quite as quickly. If you take certain medications. Blood pressure medications, water pills, and some heart medications can all make this drop more likely. I want to say clearly, I am not telling you to stop or change any medication. That decision is between you and your own doctor. I only want you to know this is a reason to be a little more careful with how you start your mornings. If you live alone. This one isn't about your heart directly. It's about what happens if dizziness or a fall does occur. Dorothy lived alone. If she'd had someone nearby that morning, things could have gone very differently. This isn't meant to worry you. It just means a few small precautions matter more. Now, if none of this applies to you, that's wonderful, and you should still watch what's coming next, because these habits are good for anyone at any age. But if you checked even one of these boxes, over 60, high blood pressure, diabetes, certain medications, or living alone, then what I'm about to show you matters even more for you. This is exactly what I gave Michael. This is exactly what I gave Dorothy, and it takes less than 5 minutes to build into your morning. All right, this is the part I really want you to remember, because everything we've talked about, the morning surge, the risks, Michael, Dorothy, all of it leads here. I'm going to give you 5 simple steps. Nothing complicated, no equipment, no cost. Just a different order to your first few minutes of the day. I call it my morning protocol, but really it's just common sense once you understand what your body is doing. Step 1. Wake up and just lie still for 60 seconds. Don't reach for your phone. Don't throw off the covers. Just lie there, eyes open, and let your body know the day is starting. This alone gives your blood pressure a chance to begin adjusting before you ask anything of it. Step 2. Sit up slowly and sit on the edge of the bed for a full minute. Feet on the floor, no rushing. This is the step almost everyone skips, and it's the most important one. It gives your blood vessels time to adjust to being upright before you add the challenge of standing. Step 3. Drink a glass of water before you do anything else. Keep one on your nightstand overnight if that helps. Remember, you've gone all night without any fluids, and this simple step helps thin your blood slightly and support your blood pressure as you start moving. Step 4. Stand up slowly and hold on to something sturdy if you have it nearby. A nightstand, a headboard, a chair. Not because you're frail, simply because it gives your body 1 extra second of support while your blood pressure catches up to your new position. Step 5. Give yourself 15 minutes before anything demanding. That means no rushing up the stairs, no lifting the laundry basket, no hurrying to answer the door. Let your coffee brew. Let your body ease into the day. 15 minutes. That's all it takes for that morning surge to level off. 5 steps. Start to finish, this adds maybe 5 extra minutes to your morning. That's it. That's the entire difference between rushing your heart and working with it. I gave Michael these exact steps after his dizzy spell in the kitchen. He tells me now, years later, that sitting on the edge of the bed for that 1 minute has become such a habit, He doesn't even think about it anymore. He just does it, the same way he brushes his teeth. Now, I also want to give you something important. Some warning signs that are different from ordinary morning dizziness and that mean you should call for help right away, not wait it out. Call for help immediately if you experience chest pressure or chest pain, especially if it spreads to your arm, jaw, or back. Shortness of breath that isn't normal for you. Sudden confusion or trouble speaking. A fall, especially if you hit your head. Dizziness that doesn't improve after a minute or two of sitting still. These are not part of a normal morning adjustment. These are signs to take seriously every time, no matter what time of day they happen. But for the everyday morning dizziness, the kind Michael and Dorothy experienced, these 5 steps are exactly what I recommend to every patient of mine over 60. Simple, free, and they work with your body instead of against it. Before we finish, I want to clear up something, because I don't want anyone watching this to walk away with the wrong idea. This video is not saying that mornings are dangerous. It's not saying you should be afraid to wake up or afraid to start your day. That's not the lesson here at all. Here's the actual truth. Your body does this same adjustment every single morning, your entire life, and almost always it does it perfectly fine on its own. The 5 steps I gave you aren't fixing something broken. They're simply giving your body a little extra time to do what it's already trying to do naturally. Think about it like stretching before you go for a walk. You don't stretch because your legs are broken. You stretch because it helps your body ease into what's coming. That's all this is, a stretch for your heart before you ask it to start the day. Michael still makes his own coffee every morning. Dorothy still lives on her own and still gets up whenever she wants. Nothing about their independence changed. The only thing that changed was giving themselves a few extra minutes first thing before the day takes over. That's really the whole message of this video, not fear, just a little bit of patience with your own body first thing in the morning. So let's bring it all together. Every morning your body goes through a natural surge as it wakes itself up. After 60, that surge can hit a little harder, especially if you're moving too fast, standing up too quickly, or you're a little dehydrated from the night before. The fix is simple. Lie still for a minute. Sit up slowly. Drink some water. Stand up with support nearby. And give yourself 15 minutes before anything demanding. 5 steps. 5 extra minutes. That's the entire difference between rushing your heart and working with it. I made this video because of a phone call from my brother on an ordinary Tuesday morning. I don't want anyone else to get that call if a few small changes could have prevented it. If you found this helpful, do one thing for me. Share this with your mother, your father, your husband, your wife, a friend who lives alone. This is exactly the kind of thing we don't talk about enough until someone we love goes through it. And please remember, I'm sharing general education in this video, not personal medical advice. Everyone's health is different. If you have a heart condition or you're on medication, talk to your own doctor about what's right for you specifically. Take care of that heart of yours. It's been taking care of you your whole life. The least we can do is give it a few extra minutes each morning. I'll see you in the next one.